Now, what is the meaning of scrubbing? Again, is just a briefing. That is nothing but to wash hands and forearms thoroughly before engaging in surgery. And the scrub implies the use of a brush, which is nothing but to clean your nails. Also, to scrub and to scrub in. We call it by different names. Maybe the person who assists or who assists the doctor for this particular procedure is called as a scrub nurse. And to scrub in or to scrub for the particular procedure means that you're assisting the doctor in a sterile way. So these are all like synonyms. You can use you can hear them use the word as scrub in, scrub up, or to scrub. So these are all similar terminologies. And what is the use of or the purpose of the surgical hand scrub, which you always know, mainly to make sure to remove all the debris and to make sure your nails are clean and there are no microorganisms, and just to ensure that your hands are sterile before you start on with the procedure. The scrubbing techniques, again, there are two methods where you use the stroke method, which is nothing but the number of brush strokes are designated. So all this depends upon the hospital policies and what you have actually learned. And it all depends that you do it fairly, because even the stroke method, you have using the brush, there are certain number of brush strokes, how you use it on your finger, the palm, the back of your hand, and the arm. Or it's also sometimes classified as timed scrub, which is what we normally do, where you perform the surgical hand wash for about 3 to 5 minutes. So either way, but the whole idea is that you do a proper hand scrub or scrub, and then you what I've just told you. Now, the sterile technique, it means it involves strategies or protocols or methods used in patient care to reduce the exposure to microorganisms, which is always there, because the word sterile itself means absence of microorganisms. So sterile technique is nothing but the technique implied by the nurse or the medical personnel to ensure there are no microorganisms as much as possible that is being present. And aseptic technique again means the same. Again, as I told you, all this you will be following the hospital policies and protocols about how it is being done, how it is being managed, and how to maintain the aseptic techniques and strategies or protocols. Because again, as I told you, there are ways of maintaining the sterility. So all this depends upon the hospital protocols and standards. So the whole idea for doing or performing or practicing this technique is mainly to minimize the risk of infection, to minimize or prevent contamination, and also to minimize complications in our patients. The sterile preparation area, again, from the where you really start the scrub area. So what we really need there is we ensure that it is definitely clean. We have water flowing all the time. Again, the mixing taps, the warm water or the cold water, again, all that is also making sure that it is working properly. Again, you have your surgical hand rub. You have a special area where you stock your gown, your mask, your cap, your shoe covers. You have a dedicated bin to throw in your the used sterile towels after you have dabbed your hands, and the skin prep, very important. And also we need the dedicated room, as I mentioned to you previously, that where you prepare the trolleys, and also where the instruments are being stored, or the stocks are being the stocks are being kept, whatever is required in the. Now, this is a scrubbing technique which I don't have to explain to you. There's nothing but the hand wash which you have actually learned. The same is also being done and doff, and that's also important. Now, patient positions are also something which is you have actually learned, and this is how you see where, depending upon the kind of surgery, the patients are being put into positions which you have to know that kind of surgery and what is what. Now, what is the meaning of draping? Again, this is what you see. So it is nothing but here in these pictures you see that the patient is being covered. You really cannot see, only the area to be operated is being exposed. So that is exactly what we are intending to do. And so draping is nothing but a procedure of covering a patient and the surrounding areas with a sterile barrier, which is nothing but your sterile drapes or the sheets that you use in order to cover the patient before you start performing the surgery. And the whole idea is to maintain the sterile field during the entire surgical procedure. So this is called as draping. And what is a drape? A drape is a surgical cloth or the material or the fabric that is used in the operating room to cover the patients and cover cloths that are used to cover the area around the patient. So we don't want any sort of contamination from us to the patient, and also from the surrounding equipments to the patient. So that is how we ensure that the patient is draped properly, and only the area that is being operated on has to be exposed. The purpose of draping again is to eliminate the passage of microorganisms from the non-sterile to the sterile areas, isolate the surgical site from the other areas of the patient and non-sterile areas. So this is what I explained to you. And the whole intention or the purpose of doing this so carefully and specifically and precisely is to reduce the infection of the surgical site. We're going to be discussing about the preparation. What is really required is the prep room or the surgical suite checklist. So what we really need to ensure that the particular operation theatre has is making sure the oxygen is on, the alarm, in case of any kind of emergency situation where you need the code blue button, you can actually press on the button or push on the button in case the patient ends up in having any kind of complication of surgery. So you know that the emergency or the code blue team is being alerted, and in case of any kind of emergency scenarios during the procedure happens, you will know that the team is ready to come and give us a hand. And the preparation room, again, it has to be clean. The table, again, examination table has to be disinfected. Also, all the supplies has to be handy. You need a clock that is actually working and running, and also the clippers and the blades that are being used, the vacuum or the dust buster, again, very, very important. The scrubs solution, the alcohol. What is that? The alcohol hand rubs, the sterile sponges, sterile towels, the garbage can, anesthetic machine with all its supplies, stethoscope, monitors which are being with all the ECG cables, the saturation probe. Even so, you need to have even the saturation probe not only for the fingers, even for the ears. Sometimes you can use that. Everything has to be handy, and all your emergency crash cart also has to be prepared there. And every morning when the nurse comes in, that is the first thing that she does is check the crash cart to ensure that all the supplies are actually being in the placed appropriately, and the adequate numbers are always there for whenever it is required. And we also need the gurney for transporting the patient. This is nothing but the stretcher, the wheeled stretcher, because in case of transporting the patient after the surgery from here back to the ward or anywhere else to any other department for any radiological investigations or whatever, you need that handy as well. And also the person to do that is also supposed to be able. And the surgery room, again, very, very important. This is the extra sterile area where, again, as I mentioned to you, make sure all your supplies are there. Make sure your monitors are working, your equipments are in good working condition. There is no fault. The first thing you do in the morning is you check your oxygen supplies, your air, your suction equipments are all working fine. And you also need to check your crash cart, your first level where you have all your emergency drugs. The adequate numbers are supposed to be there. You have a checklist actually hung on your crash cart, and every morning the nurse walks in, and that is what she does at the beginning. Check all your each level. You have the first level you have your drugs, the second level again you have all your what is that, the ET tubes, you have your airways of different sizes, and you have the all everything required for intubation. All your supplies that are needed has to be loaded in the cart. The different sizes of ET tubes or endotracheal tubes has to be there. You need to have the ambu bag, and you need to have your temporary pacemaker. And also very important, you need to have a defibrillator machine, just handy. Just we do not know what kind of complications occur. So all this is being checked by the nurse in the beginning of the day. At the same time, you need, as I mentioned to you, a running clock. We also need the anesthetic machine checked. Again, what the basic machine setup, and and all the supplies for the anesthesia when a patient is having. It is important everything is available. You need the stethoscope hanging there. Also the monitor has to be up and running and functioning effectively. As I mentioned to you, the ECG cables, the pulse oximeter, and also we need to ensure that it is in a working condition. The blood pressure cuff, it is being cleaned and wiped at the end of each day, and make sure it is being ready for use for the next patient. Capnography is also very important because this is nothing but to check the amount of carbon dioxide. So, that also has to be working fine, because very important during the surgery times. Ventilator, very important. As I mentioned, it has to be kept handy. Again, you need to ensure that it is in a working condition. The crash cart, again, the portable lights, chair available, because obviously for the staffs to feel comfortable, and any time where the anesthetist most of the time, because sometimes the surgery can go on for a long time. So you maybe only in the beginning of the procedure the anesthetist has our totally occupied in putting the patient to sleep, but during the procedure maybe he's slightly relaxed, so maybe ensure that there's a chair available so that he can just have a sit down and again observe and monitor the patient at the same time. And also all the appropriate surgical supplies for the procedure has to be. And it's very, very important that you have a runner. Runner is nothing but a person who is available as an extra person, just in case, to ensure that you need something, you're able to, instead of you leaving the department, you're able to send this person so that he can go and get the supplies for you. So this much is about how the operation theatre is being designed, how it is being, how the ideal location is being set, all the entire requirements for the particular operation theatre room, what is required, and also the areas, as I mentioned to you, from the clean, the protected, the sterile, and also the disposal areas. So all this is what we have discussed so far. Now, very important, coming to the operation theatre cleaning, which is very important. Again, as I told you, maintenance is very, very important. Again, the cleaning can be, obviously has to be done after each case. Yes, you wipe the table, you disinfect the table, the utilities, the trolley, and again, the whole, you change the bins, bin covers, everything is done, and you make sure, yes, the room is again ready for the next patient, where you're receiving the next patient for the surgery. So that kind of cleaning is done after every case. But again, you know that at the end of the day, you do a thorough cleaning. And again, you do the entire department cleaning. Maybe it's usually once a week or twice a month, depending upon the hospital protocols. And also ensuring that we need to ensure that the hospital has minimum infections or minimum nosocomial infections. And we do not want any of our patients suffering from these infections. So that is also actually the infection control department keeps a check on this, and they do their audit and ensure that every department is actually responsible in handling the infections that the patients come up with, and this is being done by the constant check and monitoring by the infection control personnel. So it's very, very important how you department. Now, how do we do this is, now we have a classification for this. Now, as I mentioned to you, some of the patient care according to the infection risk, okay, it may be classified, and this is done by Spaulding. Okay, so Spaulding classified instruments and items used in the patient care according to the infection risk. So he classified into three types, which is critical, semi-critical, and non-critical categories, and also classified the levels of germicidal activity as high, intermediate, and low. So all this is nothing but we're just trying to keep the infection under control. Okay, so that is what it means. So we do not want any speck of these germs or microorganisms in our department or area. So in case there is a high level, maybe your patients are having the procedure done and going back, but they're ending up having a fever. So we know that yes, there is some contamination that has happened, and what kind of contamination. So again, based on all this, Spaulding has given us this classification as high, intermediate, and low based on the microorganisms, the germs, and based on the infection, whether it is a very small infection, or a minimal infection, or a moderate infection, or a very critical infection. So this is also being done. So in this way, the personals are able to better care for the patient, and also ensure that this kind of lack in their services will be removed, or it is not going to be repeated. So the whole idea is not to complicate the scenario, or not to make the patient end up with any kind of complication. How it is being classified. And also Spaulding has also given us this kind of classification about how we take care of our equipments and medical supplies. So whether it just needs to be cleaned with just the alcohol spray, or the chemical spray, or it needs sterilization, or something which needs cleaning, it also needs very high level of disinfection, or whether it needs only just cleaning alone. So all this is actually depending upon the instruments, the equipments, the materials that is being used, and so based on this, Spaulding has given us this classification. The whole idea is mainly this is recommended because to avoid or minimize the risk of infection to the patient from the department. And from, when we say from the department, it can be from anything. It can be right from the floor, the kind of the trolleys that we use, the instruments that we used, even the supplies, like the gloves, the gown. So all this is very, very important how we do it, and it is very, very important that the operation theatre personnel looks into these aspects of cleaning, or also called as carbalizing, which is very, very crucial. And Now, this every hospital has got this protocol, and it is mandatory that everybody follows this. Like as we mentioned, when the personals walk in the morning again, to ensure that yes, they have had a shower, they are clean. They come in and they first go into the change rooms. They change their outside clothes and get into the scrubs. And also, their outside shoes are being taken off, and then they wear the dedicated shoes for the operating theatre room. And if you do not have one, then what we do, you wear the shoe covers over the shoes that you've actually worn and come in. So you do not walk with the outside shoes all through the place. That's very important. You ensure that yes, again, the clothes up, you have dedicated lockers where you can keep your belongings, and also you have the restroom. Again, you have the water supply that is adequate. Again, you have the shower area again where you have both the supply of hot and cold water, and again even that is actually there 24/7. And also you have dedicated or areas where you can actually discard your used scrubs, and the bins are also very. Now, coming to the cleaning schedule, as I mentioned, all this depends upon the hospital policies and protocols, very important. And what the most important things that we have to look into is about the equipments, like for example, the air conditioning. And it's very important the maintenance has to be followed up, has to be monitored, has to be observed, and it should not be missed. Again, very important that you look at it has to be done by the maintenance personals or the air conditioning who handles them. And again, very important about the sterilizers, the sterilization equipments, also the cleaning about the entire place, which involves the floors, the walls, the ceiling, all the mounting lights, the everything of every little equipment that is used in the operation theaters. Also, not to forget even the coffee area or the coffee room where the staffs are sitting there and having a break. So even the refrigerator there, the microwave there, the bench top there, everything has to be thoroughly cleaned, and all the waste has to be discarded appropriately. Very important you follow the cleaning protocols of your particular hospital. Now, between the procedures, as we mentioned, how do we manage the cleaning is nothing but you may use the for the clean operation theater tables. Disinfectant solution can be used. In case of spillage of blood or body fluids, you decontaminate with bleaching powder or chlorine solution, and always discard the waste in prescribed plastic bags, which we have learned in the biomedical waste management I mentioned clearly, and you have also seen this when you have gone for your postings to the hospital. And do not discard the soiled gowns in the operation theater just on the floor. So that's very. And the basic principles in cleaning is nothing but, is cleaning more important than disinfection and sterilization? No, they all are equally important. Cleaning is important, disinfection is important, sterilization is important. So what does cleaning do? It removes the contaminants, the dust and the organic matter. Whereas the disinfection, it reduces the number of microorganisms. And what does the sterilization do? It really cuts off, or it really removes the beginning of from the spore formation, right from there the microorganisms are being destroyed. So sterilization is the ultimate technique where we need to take care to ensure that it is done thoroughly and properly with appropriate temperatures, so that we know that all the equipments and materials that we use are thoroughly. Environmental cleaning in surgical services, again, it's very important. We have learned this in the beginning in our nursing foundation, that about how we clean the patient articles. So again, damp dusting is very important. You do not do a dry dusting because you do not want to just shift the dust from one place to the other. Again, after each surgical procedure, a clean environment should be re-established. Operating theatre room and furniture that are visibly soiled should be cleaned with the disinfectant immediately, and visibly soiled areas on the floor should be cleaned with the disinfectant